All right, so looking at what is known as a joint replacement. All right, so it's kind of like a surgery, right? So if I have a joint and there's one problem, I might want to replace, the original joint to some artificially made joint materials. So joint replacement is also known as arthroplasty. It's a surgical procedure where a damaged or diseased joint is replaced with an artificial one. Typically, the artificial one could be made up of metal, could be plastic, could be ceramic components. So it's one of the most commonly and effective treatments if there's a problems with your joint, like pains, or you can't be able to use the joint like you used to. So what is involved? The surgeon removes the worn out cartilage and bone from the joint. A prosthetic joint, that's like a man-made joint, is implanted to restore the function, then also relieve the pain. So it can be total, where the entire joint is replaced, or partial, where a part of it is replaced. You understand? So this is it. We'll come back later. We'll still talk about this joint replacement surgery, but it's to be based on joint. You understand? This one is more of like an introductory lecture to it. Okay. So common joints that will always be replaced, we have things like the hip joint, we have the knee joint, we have the shoulder joint, we have the ankle, the elbow, the fingers. All of them will still come back and make individual lectures on it. All right. So indications why you actually want to replace a joint is maybe there's osteoarthritis, rheumatoid arthritis, post-traumatic arthritis, bone deformities, all right, fractures that can't be repaired, failed previous surgeries. Okay, so recovery and outcomes is basically the recovery depends on the joint you are actually trying to work on. Okay, so this is an introductory lecture to kind of like ushering us into anything joint repair. So subsequent lectures that will be following will be basically on how to repair different types of joints.